Identification of the living and the dead. Identity of an individual is a fundamental human right. Legal identity of a person is obtained at the time of registration of birth when a name is given to a person. This affords the person to have access to his rights and benefits in civil society. At the same time, the person is also made responsible and accountable for all his actions. Therefore, identity of an individual is an essential requirement for civilian life and for the administration of justice. Identification of the living is required in undermentioned situations. At public examinations or interviews, during financial transactions at banks and other institutions, entering into contracts, for an example, marriage, attendance at workplace, immigration and emigration, and also matters concerning legal issues. And to identify living people who have lost their memory due to intoxication with alcohol, drugs, old age, disease, or immaturity. In cases of disputed paternity or maternity, mixed up or stolen babies. Tracing criminals or prison escapees and deserters from armed forces, and to identify those who have hidden their identity, both willful concealments and impersonations. Identification of the dead is required in the undermentioned situations. When a person dies, his identity is required for issuing a declaration of death form, to hand over the dead body to the family members, to register the death and to obtain a death certificate, to conduct the deceased person's last rites according to his faith, to disburse dead person's movable and immovable property to the dependents, for the survivors who claim insurance, widow's pension and compensation. If the deceased has matters pending in a court of law, his death has to be proven, to compile national health statistics. Identification of a person can be classified under general and specific identification. In general identification, the person is identified according to a non-specific criteria, such as race, gender, age, stature, build, etc. In specific identification, the person is identified by name, so that it refers only to a single person. During the identification of an unidentified body, use of general features helps to narrow down the search by excluding certain types of people and including certain others. Multiple criteria are used in the identification. Some are used for both the living and the dead, while some others are applicable only for the living or the dead. Criteria used in the identification. First of all, we are going to talk about visual identification. In this diagram, we can see how visual identification takes place. A person can be identified from facial and other features including complexion, scalp and facial hair, height, build and deformities. This method is also used in the identification of the dead. However, this is not a perfect method as mistakes have been made. The photograph on the national identity card allows visual facial identification. Secondly, gender. A person's gender is initially suspected from clothes, body contour and secondary sexual characteristics. Mistakes can be easily made using these features. The more reliable method would be to determine the gender by the presence of external genitalia, prostate gland, uterus, or the ovary. At cellular level, bar bodies and DNA studies could be used which are accurate. The latter can be used even on fragments of bones, dismembered body parts, and individual organs. The gender of an adult skeleton could be determined with 100% accuracy. Determination of gender in adults. If the entire skeleton is available, gender can be determined with 100% accuracy. Using pelvis and skull, gender determination is done with 98% accuracy. Pelvis alone, 95%. Skull alone, 90%. And long bones with 8% accuracy. In this table, we can see the male and female gender differences in the pelvis. In the male pelvis, the general size is larger and it's more massive and marked muscle attachments are there, whereas in the female pelvis, the size is generally small and smoother. The shape of the male pelvis is deep funnel, whereas the female pelvis is generally a flat bowl shape. The pelvic brim or the pelvic inlet in male pelvis is heart shaped and in female it's circular shape. Pelvic outlet in male pelvis is smaller and in female pelvis the outlet is larger. In the male pelvis, the subpubic angle is V-shaped and it's sharp with the angle of 70 to 75 degrees. In the female pelvis, the subpubic angle is U-shaped and rounded. The angle is around 90 to 100 degrees. The acetabulum in the male pelvis is larger and directed laterally, whereas in the female pelvis, acetabulum is small and directed anterolaterally. The greater sciatic notch in the male pelvis is smaller, narrow and deeper, whereas in the female pelvis, the greater sciatic notch is larger, wider and shallow. Considering the body of the pubis, in male pelvis it's narrow and triangular. In the female pelvis, it's broad, square, and if delivered children, there are pits on the posterior surface as well. In the male pelvis, ramus of pubis is like a continuation of the body of the pubis, whereas in the female pelvis, the ramus of pubis has a pinched or narrowed appearance and it's short and thick. Ischial tuberosity in the male pelvis is inverted, whereas in the female pelvis it is everted. Idiopectineal line in the male pelvis it's well marked and rough, whereas in the female pelvis the idiopectineal line is rounded and smooth. The obturator foramen in the male pelvis is oval and in the female pelvis the obturator foramen is triangular. In the diagram you can see the difference. In the male pelvis, the sacrum is long and narrow and it contains more than 5 segments. And in the female pelvis, the sacrum usually has less than 5 segments and it's broad and short. In this slide, you can see the gender differences in the skull. General size and the architecture of the skull. The male skull is larger and rugged, whereas in the female skull, general size is smaller, lighter, and wall is thinner, and it's also smooth. Parietal eminences in the male skull is more prominent, whereas in the female skull, small. Forehead in the male skull is steeper and less rounded. In the female forehead, it's vertical and round. Glabella is more prominent in male skull and less prominent in female skull. Orbits in the male skull is square, lower, smaller with rounded margins, whereas in the female skull, the orbits looks rounded and it's in the higher position and larger and has sharp margins. Supraorbital ridges of the male skull is prominent and less prominent in female skull. Zygomatic arch in the male skull is wide and extend beyond the auditory meatus, whereas in the female skull, zygomatic arch is narrow and do not extend beyond the meatus. In the male skull, occipital area has muscle lines and occipital protuberance is prominent, whereas in the female skull, the occipital area, the protuberance is not prominent and muscle lines are also not prominent. Mastoid processes in the male skull are larger and round and blunt with deep digastric groove, and in female skulls they are small, pointed and shallow digastric grooves. In this slide, you can see a diagram showing the base of the skull. Sites of muscular attachments are more marked in the male skull, whereas those are less marked in the female skull. When considering the palate, in the male skull, hard palate is larger and broader and it's U-shaped, whereas in the female skull, the palate is smaller and has a parabolic shape. When considering the mandible and teeth, the male mandible tends to have a square shape, whereas in the females, they have a pointed chin. And males have larger condyles, whereas females have smaller condyles. Mandible in the male is closer to right angle than the female. In the female, the ramus is an obtuse angle to the lower jawbone. The ramus in the male is wider and larger. In this slide, you can see the differences in the male and female teeth. Determination of the gender by using long bones. Normally, the long bones alone are not used alone to estimate gender. However, if these bones are the only ones present, there are characteristics that can be used for gender determination. Sternum is also useful in gender determination. In males, body of sternum is more than 2 times the length of the manubrium, and in the females, the sternum is less than 2 times the length of the manubrium. So usually in the female sternum, the length is less than 125 millimeters, whereas in the males, the sternum is more than 155 millimeters. And thirdly, we will talk about estimation of age. The estimation of age can be done under 4 broad categories: the fetus and birth to 2 years, then 2 years to 24 years, and after 25 years. Determination of age in a fetus is discussed under infanticide. Birth to 2 years. The increase in height during the first year of life is 1 inch per month for the first 6 months and ½ inch per month for the next 6 months. To use this method, the height of the fetus at birth should be available. The weight of the infant doubles at 5 months and triples at 12 months. The anterior fontanelle closes at 18 months to 2 years. And also, we can use the appearances of ossification centers. And also, we can use the eruption of primary dentition. Two years to 24 years, we can use the charts for weight and height gain and use the ossification centers and epiphyseal union, appearances of secondary sexual characteristics, and the eruption of the secondary dentitions. In this slide, we can see eruption of the dentitions with the age. When considering bones, The age can be estimated using the appearances of centers of ossification on bones and union of epiphyses. Ossification centers appear during fetal life and after birth. This method is used from fetal life up to about 21 years. Bones are subjected to radiography and age is assessed using ossification charts and expressed as a range. Similarly, epiphyseal union with diaphysis are also used to estimate the age up to about 21 to 23 years. After 25 years, when estimating the age after 25 years is not accurate. The criteria used include the graying of pubic hair and is the most reliable and occurs around 42 to 45 years. The facial and body hair graying begin to occur around the same time, and the scalp hair is the least reliable. Arcus senalis appears around 40 years. Calcification of cartilages of the larynx and ribs, appearances of osteophytes and osteoarthritic changes are seen above 45 years. Atrophic changes in the skin, such as loss of elasticity, thinning, and hyperkeratosis, begin after 45 years. When considering the skull, in the skull, anterior frontal fuses between 18 to 24 months after birth, and posterior frontal is fused at birth. Basiocciput fuses with basicipinoid at 20 to 25 years. Palatal sutures fuse at 40 to 45 years. Skull suture fusion can also be used, but it is variable and therefore not very accurate. Sagittal suture union takes place between 30 to 40 years, coronal suture between 40 to 50 years, lambdoid sutures between 50 to 60 years, and temporopalatal sutures between 60 to 70 years. In this slide, we can see a chart with the differences of age and the suture fusions. In this slide, we can see the age and cranial sutures. In the first image, there's completely intact sagittal suture and partially closed after few years, and then completely closed sagittal suture is in the third picture. Here we can see a diagram showing the fontanelle and the age of closure. When considering the dentition, estimation of age using primary and secondary dentition described above could also be applied to skeletal remains. Here in this slide, we can see the age determination using teeth. In this slide, we can see the mandible. How age changes in the mandible is seen. In this slide, the diagram shows the age changes with the mandible. You see at birth, the childhood, adulthood, and the old age. This is an example for an old age mandible. The use of pelvis. In the pelvic bones, triradiate cartilage fusion takes place in 12 to 13 years, iliac crest fuses at 21 years, and scale spine and the scale tuberosity fuse at 18 to 21 years. In this diagram, we can see the scale tuberosity which fused around 18 years. From about the second decade, the joint surfaces of the symphysis undergo morphological changes, and by using these changes, the age could be assessed from second to fifth decade. In these slides, the series of photographs showed the age differences with the pubic symphysis. In this slide, the diagram shows the long bones and the age differences. The long bones in the embryo, in a young person and an adult is shown here. Here in this slide, we can see the diaphysis, epiphysis, and how it changes along with the age. This diagram shows the clavicle development throughout the aging. Cervical vertebra can also used to determine age. And as the fourth factor, we can discuss about the determination of the race. The determination of race can be done using facial features, build, height, skin color, texture, and the length of scalp hair, color and shape of eyes, protrusion of jaw, teeth, and attire. When we use the identification of skeletal remains, there are certain characteristics in the bones which are specific to certain races. Using these features, it is possible to ascertain the race of the skeletal remains. Determination of race. There are three primary racial groups: Caucasian, Mongol, and Negroid. Skull is the best bone to ascertain the race. Mongoloid skull. The skull is square in shape and posterior surface of the incisor teeth are shovel shaped and zygomatic arches white. In the Negroid skull, long skulls with lowly placed orbits can be seen with wide nasal aperture and protruding lower jaw, which we call prognathism. In the Caucasian skull, it's rounded and forehead raised with narrow and elongated nasal aperture. This photograph shows the race differences with the skull. This diagram shows the differences of skulls in Black American, Caucasian and Asian people. The determination of race of Caucasian is well described in this slide. Estimation of the stature. In complete bodies, stature can be measured from head to toe. Difficulties occur when only parts of the body are found. In incomplete bodies, the following formula can be used to calculate the approximate height of a person. We can see there are three formulations to estimate the stature in incomplete bodies. This diagram shows how the stature can be determined with remaining bones. In skeletonized bodies, height is calculated using formulae devised for long bones. The lengths of long bones are measured using an osteometric board. Then the height is calculated by using the length of each bone in the respective formula. The bones used to calculation of height by this method are femur, tibia, fibula, humerus, radius and ulna. For the Sri Lankan population, the Pearson's formula modified by Kodagoda could be used. Other formulae are Trotter and Glaser and Dupertis and Hayden. In this slide, we can see the osteometric board. Clothes and personal effects. The clothes and personal effects are very useful in the missing persons and unidentified bodies. Clothes are generally useful to get an idea about the gender, stature, build, and sometimes the job of a person. Depending on the specificity of clothes, it may be possible to identify a dead body with a high degree of certainty. The contents of pockets may bear evidence for specific identity such as identity card, driving license, credit cards, and mobile phones. Personal effects in the form of wristwatches and jewelry may also afford clues for the specific identity. Limitations of making an identification by this method is the possibility of these items being either borrowed or stolen. These are some photographs which use the clothing and other jewelry to use the identification. Scars, marks, tattoos, and occupational stigma. Scars could be due to injuries, infections, or operations. Scars are useful when they are complex and unusual in appearance and location. Similarly, birthmarks, warts, and moles could be used for making a tentative identification or exclusion. tattoos and scar marks is very important to identification. Tattoo marks nowadays are made using machines, unlike in the past when it was done manually. As a result, tattoos have become very intricate, complicated, and involve large extents of the body surface. Tattoos are useful in making an identity, especially if they depict names or a unique design. In early stages of putrefaction, with the peeling of the epidermis, tattoos become more prominent. It is mentioned that some homosexuals have a figure of a bird tattooed on the first web space, and drug peddlers a 13 on the inner aspect of the lower lip. Congenital and acquired deformities. Similar to some of the other non-specific criteria, physical deformities are useful. Although their presence doesn't necessarily confirm the identity, their absence will be able to exclude a person. Congenital deformities such as cleft palate, hair lip, and webbed fingers, and acquired deformities such as amputated limbs, burr hole marks, and even pins and plates are useful. Some of the natural diseases, such as skin diseases and renal or gallstones, may be useful as supplementary evidence in the identification process. Here are some photographs of congenital and acquired deformities. Let's talk about the examination of teeth. As mentioned above, eruption of primary and secondary dentition is used to estimate the age group up to 25 years with a fair degree of accuracy. However, even after 25 years, degenerative features of teeth can be used to estimate the age. This is by using the Gustafson's method, which uses 6 age-related changes in teeth after eruption, and the age is then estimated in 10-year age ranges. Furthermore, teeth can be also provide information regarding a person's habits, such as cigarette or pipe smoking and betel chewing. Restorative work done such as dental fillings, root canal fillings, dentures, and bridges have been used to establish specific identity, especially in mass disaster investigations. Finally, when skeletal remains are discovered, pulp from the teeth can be used for DNA profiling and helps to identify the missing person with the highest degree of accuracy. This diagram shows how the teeth can be used to determine the person's identity. Fingerprints or dactylography. Fingerprints are unique to a person and remain unchanged during life and even after death until putrefaction sets in. Fingerprinting has been widely used in both civilian and medico-legal fields to confirm the identity of a living person or a dead body. In the living, fingerprints are used for financial transactions, immigration formalities, legal procedures, confirmation of attendance at places of work, and in many more instances. In forensic medicine, the forensic scientific investigations, fingerprints that are left at the scenes of crime and on weapons are used to identify an assailant. Similarly, palm prints and footprints could also be used in the identification of a person. Here in this slide, we can see the classification of fingerprint. Based on pattern of 4 types are known: loop, hole, arc, and composites. This slide shows the loop pattern fingerprint. The ridge lines enter from one side and curve around to exit from the same side. It contains one core and one delta. There are ulnar loops and radial loop. There are double loop hole and accidental hole. Different arches can be used to determine the identification with the fingerprints. The ridge enter from one side with slight bump in center and exit out the other side. No core, no delta. Holes can be used to determine the specificity of the fingerprints. The ridges make a complete 360 circle around the center of print. It contains 2 delta and no core. In this slide we can see some photographs of palm prints. Lip prints can be used to identify a person. In this slide we can see the genetic fingerprint modification system. This is how a genetic fingerprint is seen after being processed. Serology. In the past, ABO blood groups have been used in the identification process in forensic investigation. Now, by using DNA studies on samples of blood stains, hair, saliva, nail scrapings, and vaginal swabs, it is possible to make a positive identification of a person involved in a crime. The serology section of a forensic laboratory deals with the following: blood typing, characterization of unknown blood, stain patterns for crime reconstruction, paternity testing, and DNA identification techniques. These are some serological slides. Clothes can be used, the weapons can be used to serological identification. Blood groups can be used to identify a person. There are major and minor blood groups. Let's see about radiology. Using antemortem X-rays, it is possible to make a specific identity of a person by detailed comparative studies of old healed fractures, pins and plates, prostheses such as heart valves and pacemakers. Radiological studies of a restorative dental work such as fillings, bridges, and root canal fillings could also be used in the identification. Frontal sinus air cell pattern of an individual, the scalloped upper border of the roof of the frontal sinus, is unique to a person. Therefore, if antemortem frontal sinus X-rays are available, it could be compared with the postmortem frontal sinus X-rays to see if they match. These are some radiographical images which we use to determine the identity of a person. Both age and race can be used with the imaging studies. Gender can also be identified by using radiological methods. This slide shows how the photo superimposition is used to identify a person's identity. Facial reconstruction. Identification of a person from the skull is also possible by radiographic superimposition and facial reconstruction techniques. This slide shows how we develop the face of a person starting with the skull. This is how the facial reconstruction takes place. This is a diagram showing the facial reconstruction. Thank you.